Paying more for the same drug, let's explore brand versus generic. Stephanie here. This is a very easy concept to understand. I'm here to help you pass the medication administration program, the MAP test. Some states call it the Meditech. So let's talk about the difference between a generic name or a brand name. So essentially, I will use the example of Tylenol, all right? Because most people have understanding of that medication. Now, notice I just said Tylenol, right? When you walk into a CVS, you always see the brand name. Tylenol is the brand name. And then you see the generic name. And the generic name for Tylenol is acetaminophen, right? And so usually the generic is cheaper, but that's neither here nor there. For the purposes of MAP, we do not expect for you to be able to have every med ever created in your mind, right? So it's an understanding. So now a doctor chooses whatever they choose to put down. Most doctors tend to write it in brand form that I see, and usually pharmacy gives it in generic form. But say the doctor, and the scenario we've been using is John Smith, orders Tylenol 100 milligrams by mouth daily. Okay. Now, when you look at this order, you do not know if it's brand or generic. And what's most important is that you should not guess, right? So there's nothing about MAP that's a guessing game. You have to know what paper, what document to look at to see the difference. So in the MAP world, they then give you a generic equivalence table where one column will have the generic names and the other column will have the brand names. So you are to look at that table and decide if Tylenol is a brand or generic. And in this example, it's a brand name. And you write that on the medication grid under brand. And then acetaminophen, you would write it under generic. You know, with transcription, it has to be 100%. So you would make sure that your spelling is correct. Okay. So essentially, the chemist, I'm not a chemist. I don't create drugs, right? So they'll make a drug and a brand. So for example, the school that I have is called Healthcare-Edu, healthcare/edu. Okay. And I teach nursing assistant, MAP, other allied health certificates. So I am not the only person in my location or in the United States that teaches nursing assistant courses, right? So that would be viewed as generic. The nursing assistant regulations state that these are the items you have to teach, 75 hours, all of that, okay? And so all the CNA programs who meet that expectation, you can make an analogy that it's like a generic medication. So now my school, the brand Healthcare-Edu, and that's actually what you call it, a brand. I have my colors that represent me, my logo that represents me, how I teach that represents me, the environment, the culture, how I present the information, how I run my labs. So that's the brand. Your experience that you have at Healthcare-Edu is the brand. So I hope that makes sense, where you have generic and you have brand medications. So I want you to take your time, look at those equivalent charts, and you could click the link somewhere below. There's like a review course with practice questions and everything like that. You can look at the chart, make sure you put it where it says generic, put the brand name where it says brand, and make sure everything is spelled correctly. But I hope this provides you an understanding of the differences between generic and brand. All right, take care. Bye.